The reproductive examination of the male dog, sperm collection, and examination and validation. So for examination of the male dog, you need to look at the history, the scrotum, the testes, the epididymis, the penis, the prepuce, and the prostate. For the history, look at the age, vaccination, experience, breeding data, stress, trauma, or any drugs like amoxicillin clavulanic acid, which decreases the quality, or any reproduction problems, diseases, and the prostate. For the scrotum, do inspection and palpation. See if there's any inflammation, trauma, swelling, adhesions, nodules like granulomas and tumours, or any thickening such as tumours or inflammation or enlargement. For the testes, you can do inspection, palpation, and ultrasound. Look at the size, the symmetry, and the shape. They should be oval and smooth, and the consistency should be firm but not hard. For the epididymis, you can palpate it. It's dorsolateral to the testes. And for the penis and prepuce, have inspection and palpation. The prepuce covers the penis. There should be little prepuce discharge, and it should be white or pink and have smooth mucosa. And the prostate can be examined through the history, palpation, and ultrasound. For semen collection, the manual technique is using an artificial vagina. When this happens, make sure it's quiet, non-stressful, and there's not a slippery floor, and have a teaser bitch. And have a clean, sterile glass container. Allow the male to have contact with the female. Allow him to sniff her and lick her. And then have manual stimulation and ejaculation, and then collect 2 fractions. Bend the penis back 180 degrees. It imitates copulary lock. And then observe the male penis until it returns to the prepuce. Fraction 1 is pre-sperm. It's about 0.5 to 5 mils. It's from the prostate and it's clear and acellular. Fraction 2 is sperm rich. It has 1 to 4 mils. It's thick and milky. And fraction 3 is prostatic. We need to collect fraction 2. For semen evaluation, the volume should be 2.5 to 8 mils, and it depends on the age, the size, the frequency, and the prostatic fluid. The colour should be cloudy white. If there's yellow, it means there's urine, and if there's yellow or green, it means there's pus, and if there's red or brown, it means there's blood. The pH should be 6.5. The motility should be over 70%, and the concentration should be 4 to 400 multiplied by 10 to the power 6 per ml. And for the morphology, the over 80% should be normal spermatozoa. And in the cytology, some epithelial cells are okay. For semen preservation, fresh should be max 1 hour, no dilution. Chilled is 1 to 2 days at 5 degrees Celsius and it's diluted. It's diluted with a tris egg yolk extender. And frozen is at 196 degrees Celsius. And it's kept in a 0.5 ml straw. For semen evaluation, we use a Burker chamber and a microscope and a heated lamp. We do photometry to see the concentration, hypoosmotic swelling test to see the viability, and perioxidase to see infection, and spermax staining to see if the sperm is dead or alive. CASA is computed assisted sperm analysis. It looks at the morphology and the motility. And fluorescent dyes also help look at the morphology. The tail abnormalities are proximal protoplasmic droplet, distal protoplasmic droplet, as seen here, a bent tail, folded tail, a coiled tail, a double tail, and degenerative. The head abnormalities are a giant head, a round head, an acrosome defect, an acrosome swelling, a narrow head, a narrow base, and a double head.